Thanks for coming. My name is Nikki Sheets. I am a Senior Policy Fellow and Lecturer here at SPIA, more particularly in C-PREE, the Center for Policy Research on Energy and the Environment. And I teach a course on environmental justice policy, and we have a speaker today on environmental justice and public health. Her name is Rachel Morello-Frosch, and I'm going to start off by reading things to you so I get them correct. Rachel is professor at the School of Public Health and Department of Environmental Science at Berkeley, UC Berkeley. This year she is a Radcliffe Fellow at Harvard Radcliffe Institute at Harvard Radcliffe University. Rachel is an expert in environmental justice, public health, climate change, local air pollution, epidemiology, and I'm going to put down my tag here and just say, because I've worked with Rachel for years. And let me describe her as we describe her in environmental justice. So I'm part of the environmental justice grassroots movement. Let me describe her as we describe her in the environmental justice grassroots movement, well, and in academia. Rachel's one of the top 2 or 3 EJ scholars in the country. I won't order them, but recognized by both EJ people and academic people as one of the top EJ scholars in the country. The areas I talked about, climate change, local air pollution, environmental justice, cumulative impacts. She takes the statistics, quantitative methods, and qualitative methods, and examines these areas in detail, but maybe most importantly, she then translates her research and her findings into language that can be and is used by the EJ grassroots movement. So she works directly with the EJ grassroots movement, and when I say that, I mean communities of color, and communities with low income. And she's so respected by the EJ grassroots movement that in New Jersey, when I was trying to convince the New Jersey Clean Air Council to address EJ and cumulative impacts, I flew Rachel in. That was a little while ago. We were talking about this last night. I flew Rachel in to talk to them. And when we were trying to convince the New Jersey Department of Environmental Protection to develop regulations for groundbreaking environmental justice law, we were trying to convince them to develop regulations from the EJ perspective. What do? Well, we had to meet with Rachel, this time virtually, but we put them on a Zoom call with Rachel so she could talk to them. So that gives you the level of respect that we have for the EJ community. And similarly, when I was thinking of, well, folks at SPIA need more information on environmental justice and all these other topics, right? Public health, I asked Rachel to come and speak. But she's not only respected by the EJ grassroots folks, but she's so respected by Berkeley and the academic community that I want to let you know that beginning in July, she is going to be she has been appointed Associate Provost of Energy, Climate, and the Environment at UC Berkeley. So Rachel, thank you very much for coming and sharing some knowledge with us. We really appreciate you making the trip.
First off, I just want to thank you for inviting me. I've never stepped foot on the Princeton campus until today. It's an amazing spot, and it's great to be in the School of Policy. And I want to thank the team that arranged for me to come here, and thank you, Nikki, for hosting me, and it's great to see Eric again after a year. We were together in a conference at Rice University. Today I want to share some work that I've done with colleagues, thinking about how do we talk about, I'm an epidemiologist and environmental health scientist by training, and one of the things, so we do a lot of statistical work, number crunching work. How do we think structurally about the disproportionate impacts of climate change on marginalized communities, communities of color, poor, et cetera, to really understand its origins and its persistence today, which then can in turn inform the strategies about how we address climate change and try and embed equity into the design of climate change policies going forward, so we don't continually replicate and or potentially amplify environmental injustices. And then the second piece I want to talk to you about is how do we, things are dismal right now at the federal level in terms of addressing climate change. But states have been doing things for a while. And my home state of California has been at it for quite a while. And this has provided opportunities to examine what are the short-term benefits of climate change policies above and beyond achieving our greenhouse gas reduction goals. And how can we do science that can inform that conversation about the co-benefits of climate change policies. And then the last part of my talk will sort of walk you through how do we develop tools that can aid in decision making, both at the community level, but also at different levels of government, municipal, state, and national. In this case, a study that we did looking at sea level rise related flooding threats, both to housing and hazardous sites. Okay, so that's sort of an outline of where I'm hoping to take you today. Okay, so I like to start out with this schematic, which was based on a commentary that we wrote a little while ago for the New England Journal of Medicine, because New England Journal of Medicine was really trying to put climate change in front of clinicians and others to really start thinking about this. Professional societies are also can be very powerful in being advocates for addressing the impacts of climate change. And so we really tried to elevate this question of climate justice and this term, the climate gap. And really we're trying to get people to see that this just didn't happen by accident. There's long legacies of structural racism embedded in housing and land use decision making that's been going on in this country for literally decades. So things like discrimination in lending and real estate industries, dispossession of indigenous land, for example. This has led to what we currently see in the landscape in terms of racial residential segregation, wealth and income inequality, and inequalities in political power, all of which have enabled the creation of what we now see as sacrifice zones, the disproportionate siting of many of the major greenhouse gas emitters and polluters related to the fossil fuel industry, for example, but the chemical industry, the power industry, all kinds of things in marginalized communities, and the ways in which privileged groups benefit from those arrangements, whether as stockholders or as industry heads, et cetera, and that there's unequal regulatory enforcement of those regulated industries. This leads to what we see in terms of disparities in exposures to fossil fuel related pollution and higher pollution levels overall. So I'm not going to show this to you today, but I'm happy to talk about it during Q&A. But some of our work has shown, for example, that metropolitan areas that are more racially segregated, in addition to having communities of color have worse air quality within those metro areas with high levels of segregation tend to have worse air quality overall compared to metro areas that are less racially segregated. That sort of makes sense in part because, for example, in more segregated cities, people have to drive longer distances, for example, to access services, their jobs, et cetera. And then, so these disparities in exposures can lead to what we call the climate gap, where we see racialized and class-based disparities in the effects of climate change impacts, whether we're talking about heat, storms, wildfires, and then the concomitant impacts, housing loss, displacement, et cetera. Okay, so this is an example of a sacrifice zone that probably many in this room have already heard of. This is known as Cancer Alley in the area extending between Baton Rouge and New Orleans, Louisiana. And there are tons and tons of chemical and petrochemical companies that emit a lot of toxic air pollutants for decades. Regulatory oversight is quite problematic. There's many communities who literally abut these major facilities and who have been suffering the health effects of these industries for quite some time. And then this map on the right is The same region, this is land that, this is what the land, how it was divided when settlers came here and then slaves were imported to cultivate mostly sugarcane in the same region. And so many of the people that live next to these hazardous facilities are the ancestors of people who worked as slaves to cultivate sugarcane earlier on. So again, it's trying to provide a little bit of a historical context of how did we get here? How did a place like Cancer Alley come to be? It has a long, very long history dating back to slavery. Okay, so this is a map here of the United States. And again, that schematic that I just showed you is trying to explain why we see such variability in levels of racial residential segregation in the United States. So this map is showing you about 310 metropolitan statistical areas in the country. So it's the main city and its surrounding suburbs, okay? It measures, it's called the Multi-Group Dissimilarity Index, which measures the physical separation of different racial and ethnic groups that live within these cities. And so basically the measure says what proportion of people would have to get up and move from one census tract to another in order to achieve an even distribution of the different racial and ethnic groups that live within that city. So the cities that are in darker red are considered hyper-segregated, where more than about 60% of people would have to get up and move from one census tract to another in order to achieve an even distribution. And the ones in yellow are considered more moderately segregated, less than 40%. And, you know, again, this didn't happen by happenstance. Decades of discriminatory land use and decision making, things like redlining that people often point to. Lots written on this, including this book. So people often talk about the history of racialized redlining, which was something that came out of a policy through the creation of the Homeowner Loan Corporation in the early 1930s in the wake of the Great Depression under FDR. And the Homeowner Loan Corporation's mission was to help households not default on their mortgages because of the Depression. And so the goal was to help bail people out from that. So that was a good policy. The problem was that the Homeowner Loan Corporation was charged with grading neighborhoods in cities where they were going to be deploying this policy from A to D, and based on a bunch of criteria, including racist criteria about the racialized makeup of a neighborhood. So this is an example of a neighborhood in Los Angeles. You can see the description of the neighborhood in terms of, and some of the racist language that was used here. This neighborhood was graded D, and its D neighborhoods are colored in red in the maps, i.e. the term redlining, okay? So, and I want to emphasize, these maps were digitized several years ago by Richmond University in their Mapping Inequality project. And so it became kind of a gold mine for people like me, because all of a sudden we had these digitized maps and we could do some really interesting spatial analysis to look at the extent to which the racist implementation of a policy could be having deleterious effects on environmental quality today, whether that's access to green space, air quality. There's been a proliferation of studies, including from our group, looking at the relationship between historical redlining and different environmental quality indicators because of the availability of these maps. I also want to emphasize that these maps are very powerful. You look at these descriptions, you see things like this, and you're like, wow, it's all about redlining in the 1930s. But the reality is that lets a lot of other entities off the hook in the private industry and in government. These maps were simply a reflection of what racialized and racist policies that have been going on decades prior. It's not just, you know, the Homeowner Loan Corporation redlining maps that led to the situation that we are in now. These maps simply reflect what had been going on at the municipal, state, and federal levels prior to the creation of the Homeowner Loan Corporation. Okay, so why do we care about this? Well, as I said, there's been a lot of studies looking at the extent to which redlining is still exerting impacts on environmental quality and exposures to environmental hazards today. This is one example of a study that my team did a few years ago, looking at the relationship between the presence of oil and gas wells in 33 US cities across the United States. And the reason why we had 33 cities, because these cities had to be cities that were mapped in the early 1930s by the Homeowner Loan Corporation, so they had to be graded. And the second criteria was they had to be overlaying an oil field where there was potential to do oil and gas development. Okay, so that's how we ended up with that sample size of cities. And so we asked a simple question in terms of our modeling, which was, to what extent do we see a relationship between grade, A being the best and D being the worst, and the number of oil and gas wells? These different colors of purple are different definitions of how we define a neighborhood that is near or contains at least one oil and gas well. And then we also asked, to what extent did this pattern already exist before these maps were drawn? So this is looking at the relationship between grade before these maps were actually drawn. And you can see there is a bit of a relationship, which is not surprising because other criteria for downgrading a neighborhood was the presence of industrial activities, including oil and gas development. But then what we also see is that after appraisal, this relationship even gets more extreme. So it's kind of sort of a continuous kind of feedback effect. And we care about this because there's been a proliferation of studies. Initially, a lot of that work started in the Marcellus Shale in Pennsylvania, also in Texas. With the proliferation of fracking technology, there became a growing and mounting concern about the effects of hydraulic fracturing on community health. Many of us focused on perinatal health outcomes and birth outcomes in terms of the relationship between living near fracked wells and adverse effects. And we started to look at this in California, which is a completely different animal. It was interesting because not a lot of studies until we started doing this work had been done in California. Because California doesn't do a lot of hydraulic fracturing. It's a very small proportion of our, the way we develop and extract oil and gas from the ground. Our oil and gas infrastructure is well over 100 years old. And so unlike more rural areas like in Pennsylvania and Texas where a lot of that exploration is happening, we have oil and gas wells in major metropolitan areas. They're near schools, they're near where people live in highly urbanized areas and also in rural areas. So it's much more mixed. And we have about 3 million people that live within a kilometer of an active oil and gas well in California. And yet no one had really looked at this question in California, even though we have different oil and gas infrastructure. And the oil and gas industry would push back and say, well, we don't do hydraulic fracturing in California, so there's no problem there. And the reality is, it wasn't that there was no problem, there just wasn't any data. No one had really looked at this question. So our team and some other colleagues started to do studies in California, and we did see pretty strong and robust associations with living within at least a kilometer of an active oil and gas well, also taking into account the density of that production in terms of barrels of oil equivalent extracted per year. And we saw relationships with higher risk of having a low birth weight baby, higher risk of having a small for gestational age birth, slightly higher risk of a preterm birth with a little more equivocal evidence there. And a lot of this evidence got people thinking in the legislature, and there was a lot of environmental justice organizing that had been going on for years to try and get the agency that regulates the oil and gas extraction industry in California, CalGEM, to do a better job of regulating this industry. Because there had been some scandals that they were just like issuing permits without a lot of review. And so they appointed a public health expert panel for California. I had the privilege of co-chairing it with a colleague from physicians, scientists, and engineers from Healthy Energy, and we got scientists from across the country who've worked on this issue to come and do a systematic review of all the evidence that we know about oil and gas extraction, including the work that we had generated in California. And we were able, our work was able to kind of provided the body of evidence to support passage of legislation to better regulate oil and gas development in the state. Industry has been fighting this tooth and nail. It was stopped for about a year and a half. They lost, they withdrew a lawsuit. So now it's proceeding forward, but I think it's still going to be a challenge going forward, so we're trying to be vigilant to ensure its implementation. And just so you can see, this is just one example of a study that we did where we looked here at the relationship between active oil and well production volume and proximity with two birth outcomes. This is looking at low birth weight on the left. So anything, the odds ratio above 1 indicates that it's statistically significant. And you can see that the effects are strongest for births in mostly rural areas here, a little less so in, much less so in urban areas. And here is looking at decreases in term birth weight, so anything below is bad. And you can see the average decrement in birth weight is about 35 grams, particularly for rural residents. And just to put that in context, that's what you might expect from like exposure to ambient cigarette smoke during pregnancy. Okay, so I want to switch gears now and talk about, it is very important to document the problem in terms of trying to understand the health effects of climate drivers, the health effects of climate change impacts. And now that some states have been doing climate change policies for quite some time, there's also opportunities to really leverage what we're calling solutions-based science to see if we can highlight some of the short-term health benefits of climate change policies, if there are any to be highlighted, and then also develop tools and analysis to support efforts by environmental justice communities that are trying to develop their own resilience plans, often at a localized scale. Other organizations are working more regionally together and statewide, so it really depends. So I'm going to show you examples of both of these. So in terms of short-term health benefits, first example I want to talk about is the documenting the impacts of California's Global Warming Solutions Act. It was passed in 2006, the first one, AB 32, and had pretty ambitious greenhouse gas reduction goals, and then it was renewed again through SB 32 with even more ambitious greenhouse gas reduction goals. The first iteration really kind of took care of what we call the low-hanging fruit and achieved its greenhouse gas reduction goals 2 years before the set deadline, and now we're really grappling with some of the more harder stuff. So one of the things that happened, the Global Warming Solution Act was the culmination of years and years of work by mainstream environmental groups, legislators who really wanted to do something about, and the governor, who at the time was Arnold Schwarzenegger, a Republican, although probably not considered a real Republican these days. But, and so there was a lot going on in the run-up to the passage of this legislation. And so industries like the power industry saw the writing on the wall that something was going to happen with climate change, and that at some point, relatively soon, they were going to have to start paying for something they used to be able to do for free, which is emit greenhouse gases. No one was clear about whether or not it was going to be a carbon tax or a cap and trade system, but they knew that they were going to have to pay in some way. Something was going to happen. And so the power industry, in particular in California, started retiring power plants that they knew were going to be inefficient, that had been running for quite some time. And so during an almost 11-year period, or 10-year period, there were about 8 power plant retirements during this time in the run-up to the passage and then after the law was passed. And so I was, at the time, had an amazing postdoc who's now a professor at University of Washington, Joan Casey, who was like, maybe we should look at this and see whether or not we can see some short-term health benefits of these power plant retirements. Like there's enough where we might be able to do this, what's called a natural experiment. So those of you who are in economics probably have done these kinds of things before. And so we first we looked at communities that were different buffer distances from the power plants that retired, so less than 5 kilometers, 5 to 10 kilometers, and then 10 and 20 where we would anticipate probably not as much of an air quality impact. And here we were just kind of stuck using US EPA and California Air Resources Board monitors, so it's kind of a crude assessment. It's not like good modeling at a granular scale. So this blue line is the levels of PM 2.5 pre-retirement, and then post-retirement is in the light green. And you can see, a slight decrement, although the range is still pretty huge. So it suggests that, at least for PM 2.5, air quality did seem to improve a bit in the post-retirement period. But then we wanted to see, to what extent might we see a signal with declines in preterm birth rates, because there's been a lot of studies showing that higher levels of exposure to PM 2.5 can increase the risk of preterm birth as well as other adverse fetal growth outcomes during the perinatal period. And so these are the results. So I just want to draw your attention. This is looking at the change in the post versus pre retirement periods in terms of the proportions of preterm birth overall. So we saw basically that the power plant retirements were associated with an average 2% reduction in preterm birth rates. And we saw that the effect was strongest in terms of late preterm birth, not so much with the super duper early gestational ages, which tend to be associated with underlying issues with the fetus that may have absolutely nothing to do with environmental factors. So just to put that in perspective, if you think about how many babies are born in California every year, like if I invented a drug that reduced preterm birth by 2%, people would probably really want to invest in my drug company. And that was actually what a commentary said when we first published this study. And the other thing that I want to draw your attention to is we saw the most dramatic effects for the pregnant folks who were self-identified as Asian or African American. This is not, these confidence intervals are wide, so you need to take it with a bit of a grain of salt in terms of statistical significance, but it does suggest that the benefit is potentially stronger for African American and Asian mothers, also suggesting not only an overall benefit for perinatal health, but potentially a health equity benefit for a health outcome that disproportionately affects Black women and other women of color. Okay, so that study came out, and then we have moved on to power refinery retirements. And these have been more recent. And this is a work in progress, so you can take these results with a big grain of salt right now because we're still crunching numbers. But we are looking at 4 refinery retirements in California that have occurred over a period of 10 years. And so this map on the left kind of shows you where they are. And then, and this one in the San Francisco Bay Area is the Marathon Martinez plant, and I'll come back to why that's important in a second. And we're looking at what we considered kind of our study areas and the exposure areas based on PM 2.5 modeling that we could attribute to the power plant itself, to the refinery itself. And here the results are a little more mixed, not quite as dramatic as what we've seen for power plants, but we do see some signal. So this is looking at preterm birth, where we really didn't see an improvement in preterm birth rates in the refinery retirements. These are all not significant, statistically significant, and the effects are quite small. We did see a decrement in term low birth weight, particularly for this one in Bakersfield, and a reduction in small for gestational age, again for this one in Bakersfield, as well as this one in Paramount, but the others, not quite so much. So again, we're still working on some of our analyses to see if we've addressed some unmeasured confounding that might explain our results. So this is still very much a work in progress. I want to point out this retirement, this Marathon Refinery retirement occurred almost in the exact same month when we all shut down for COVID in March. And so it's been very tricky to try and figure out how we can account for that noise. Because the other thing that we know is during the early days of COVID, when vaccination wasn't available and there was pretty much no herd immunity, infection with COVID during pregnancy did increase the risk of preterm birth during that time. Now, not so much because people have either had COVID or been vaccinated, and so the risk has diminished significantly. So this is a little bit more of a tricky analysis for us, and we're still working through it. Okay, so the last thing I want to share is how we've been collaborating with EJ communities that have been trying to do resilience planning to think about sea level rise related flooding threats in low-lying coastal areas. And I'm going to show you just two quick examples related to threats to housing and hazardous sites. So probably don't need to run through all this with this group, but sea level rise is definitely accelerating. And there's a lot of concern and community concern in particular to housing in low-lying areas, and then also environmental justice communities that live in low-lying coastal areas who also disproportionately host hazardous sites that use, process, and store toxic substances, or, for example, that are near Superfund cleanup sites are extremely worried about this issue. And we've seen like major storms like Hurricane Harvey and Hurricane Katrina, where the emissions of both air pollutants and pollutants released to land and water from industrial facilities can be quite traumatic. This is our team. This is a collaboration with Berkeley and my colleague Lara Cushing at UCLA, as well as scientists at Climate Central, who did a lot of the sea level rise projection work with us, and then our illustrious graduate students and postdocs, and then our EJ and public health collaborators who co-wrote the grant with us and helped us with the study design and development of the tool that I'm going to share with you. So the first project we did was to try and do like a screening to estimate threats to housing in low-lying areas. This was a paper that we published almost 6 years ago now almost. On the left in figure A, you see the number of housing units that would be exposed to a 1 in 100 year flood event projected to 2050 in the worst case emission scenario. And on the right, you see the number of units that would be exposed at least 4 times a year to a 1 in 100 year flooding event. And then figure C below looks at the percentage of housing stock exposed per year to such events by state. And the green bars are affordable housing units, either because through Section 8 or government programs or through market. And then the gold bars are general housing stock. And then we were funded through US EPA STAR grant to look at flooding threats to hazardous sites. That grant was, and another one which on a project that I am not talking about today, those were both canceled, and we had to pause for a while. And then our illustrious colleagues from the law school at Berkeley enlisted a private law firm, a big litigation firm, and they got all the EPA STAR grants for the entire UC system reinstated, so we were able to finish our work. So this is where you love your colleagues, because the administration was not prepared to challenge the Trump administration in that way. But so a lot of us got to finish our science. So I just want to extend some gratitude to them for that, because what you're seeing here today would not have been possible. So we know that many of the hazardous facilities that we looked at are disproportionately located in poor communities and communities of color, and until recently, a lot of the sea level rise related research is focused on property. And so the goal here was to really look at the intersection between hazardous sites, sea level rise, and the extent to which EJ communities might be disproportionately at risk of hosting sites that are at risk of flooding. And so the goal was we're going to do the first national assessment of flood risk due to sea level rise, and it's a screening of all the sites that we could analyze. Test the hypothesis about the extent to which marginalized groups are more at risk to live near these at-risk sites, and then develop a tool that others could use. So we compiled and cleaned for a very long time data on that included 48,000 coastal sites of facilities that have toxic materials on site for various reasons. These are the data sources that we used. And we classified, then we categorized them into big buckets just because our EJ partners were like, you got to put these in categories, otherwise there's just way too many there. So I'll show you the categories we ended up with. And then we intersected it with tax parcel data so that we're not just like looking at a point on a map, but we're actually trying to estimate the physical extent of these hazardous sites. And then we derived a couple of coastal flood event probabilities, including the expected annual exposure or the chance each year that there would be a coastal flood high enough to inundate a significant portion of the site, and that we defined an at-risk site of those with had 25th percentile elevation and had an EAE of greater than 1% or a 1 in 100 year flood event. And we focused on census block groups to do our equity analysis. And we defined a block group as exposed if they had people residing within 1 kilometer of an at-risk site. And today I'm just going to show you, we looked at 3 outcome metrics. I'm just going to show you, number 1, the extent to which they're hosting at least 1 at-risk site. And then our indicators of demographics and social marginalization were based on the census data, American Community Survey, voter turnout data, and then we also used the Biden administration's climate and economic justice screening tool, which is a yes-no variable of defining disadvantaged communities. So these are the results. These are in a high emission scenario, so RCP 8.5, and projections for 2050 indicated that of the 48,000 sites that we analyzed, about almost 3,800 sites were at risk. For 2,100, about 5,500 sites are at risk. And these are the estimates, these are the results for 2050, these are the results for 2,100. And these are the high states that came up at the top with at least 1 site. And then these 11 categories are the facility types that we had. So everything from power plants to concentrated animal operations, landfills, incinerators, cleanup sites like Superfund sites, refineries, ports and terminals, oil and gas wells, and formerly used defense sites. And so you can see, the states that have the most number of sites. And I just want to point out that 7 states account for 80% of the at-risk sites. So if we want to focus our efforts on climate resilience and addressing them, we can narrow our focus there. So we're talking Louisiana, Florida, New Jersey, Texas, California, New York, and Massachusetts, Maryland. And we did see that indicators of social marginalization, and we did separate logistical regression for each of these indicators because they are pretty highly correlated, some of them. So this top one, disadvantaged status, is yes-no variable based on the CGEST. And so there was a 50% higher odds in disadvantaged communities of hosting an at-risk site using the CGEST. And then same thing with renters, 41% higher odds per standard deviation unit increase in the proportion of renters. And basically, all of these odds ratios and 95% confidence intervals, anything to the right of this dotted line is considered statistically significant. And then these are the odds ratios that I just showed you in that figure, in that forest plot. This is looking at 1 kilometer buffers from populated areas. And just to do some sensitivity analysis, we extended it to 3 kilometers, and the effect estimates were pretty consistent. So, in addition to publishing a paper in an academic peer-reviewed journal, which that's what we have to do as university professors, but unfortunately, the only people who tend to read those are our colleagues. We developed a tool, which I'm going to show you in a second, but in terms of the conclusions, we, again, to reiterate, 5,500 sites at risk by 2100. And that a majority of these will remain at risk even if we reduce greenhouse gases. So the difference between like a 4.5 RCP would have reduced the number of sites by about 300. And you know, this could all change. These are projections because there could be mitigation efforts, people could move, demographic shifts, et cetera. And there are definitely uncertainties and limitations in our study that could have led to an over or underestimates of the number of at-risk sites. So we didn't look at all hazardous facilities. We didn't include pipelines, for example, which we know are highly vulnerable, but the data on that are not so great, and we didn't feel confident in including it. For the national analysis, we did not account for groundwater upwelling, which is a big issue with sea level rise. And we did a separate California study a few years ago where there were data available where we did take that into account. But for this national study, we couldn't find a consistently reliable data source to account for that. So and this is a huge issue, groundwater upwelling, particularly for mobilization of toxics on land. And we may have overestimated the exposure in some of the extreme storm events based on some of the sea level rise and flooding modeling that we did. So this is a screening exercise that can help target site-specific assessments of places that look vulnerable. In California, the Coastal Commission allocated resources that our screening tool highlighted were at risk and have provided funding for communities to do more work to assess how they want to plan for addressing some of these hazardous locations. And then this is the tool that we developed. This is hosted on Climate Central's website. So all of this data that we analyzed and published in Nature Communications is available on this tool. It's in English and Spanish. People can look at different things that are of interest to them. They can hone in on particular facilities of interest to them and then look at what we know about those facilities. They can focus on different demographic variables of interest, and they can also change, the severity of emissions and flooding scenarios to look at how much of a difference that makes. And then all of the data are available on that website and can be downloaded by, with one exception, the oil and gas well data is not up there because Inverse, that's proprietary data, but everything else is up there and available for other people to analyze. And then Climate Central, this was very fortuitous. They were working on a separate project called Flood Vision, where a little over a year ago, they were driving like a Google car from Maine all the way down the coastal areas of the eastern seaboard and then throughout the Gulf Coast all the way into Texas, taking pictures of neighborhoods that are experiencing or likely to experience sea level rise related flooding events, and then doing visualizations about what neighborhoods and other places would look like in different types of flooding scenarios. So we were able to share with them the types of sites that had been screened and targeted in our screening analysis, and then they were able to provide these visualizations that are also available on the website so people can see what these places could look like in a severe flooding event. And that's it. Thank you for your attention. Look forward to questions. Yeah.
Thank you so much for your talk. Going back to the redlining study, one of the questions are, I'm curious about the role of gentrification in some of those neighborhoods. So but like considering which neighborhoods have gentrified and if they have the same exposures as non-gentrified redlined communities. Was that a consideration in that study?
So not in the oil and gas study that we did, because we have been starting to look at that in California, because there's actually, gentrification is a challenging thing to measure. It's very fraught, and there's a lot of controversy about how you measure it. I have a great colleague who was at Berkeley, who's now at University of Toronto, who started this project called the Urban Displacement Project. And they have provided some really excellent data and code to have a more kind of sophisticated analysis of gentrification risks in neighborhoods. And California has some pretty decent coverage. So we've been trying to look and answer this really important question that you just posed. I don't have answers for you yet, but, and ideally, like if we could get that kind of gentrification data available for places across the country, I think we could dig more into that question. And the extent to which gentrification has shifted patterns of exposures, not only to oil and gas, but to other kinds of hazards, or the extent to which air quality has improved with gentrification despite history of redlining, things like that. So stay tuned. I think this is a underexplored area of inquiry, actually, and something that, because there's been such a proliferation of these redlining studies, and that's the obvious next really important question to dig into. Yeah. Yeah.
Thanks. On the question of the impact of California's climate policies on emissions locally, could you elaborate on the mechanisms that might be compounding each other? I'm trying to understand, for instance, you showed plots where there was a decrement in emissions or exposure, but at the same time the air bar was very large, and maybe some communities, it was hard to tell if for some communities there was any difference at all. So I'm wondering what countervailing forces are causing potentially decrease or exposure to stay the same. So I guess the one hypothesis is that emissions are lower because of retirements, so you would expect the exposure to be lower. What is potentially countervailing that? Is it that emissions elsewhere go up and then those communities are exposed to the same level of emissions, or am I right to hypothesize there's countervailing effects, or?
No, I think, yes, that's it's a really important question, and when you do these kinds of analyses, the difference in differences, you're trying to compare the extent to which your affected area where the interventions happened, whether those changes in trends are unique to what's going on just in terms of overall broader temporal trends, either in air quality and or your outcome of interest. So one of the things that we did, and you can read about in the papers, in order to kind of test those assumptions, we also did a scrambling of the dates of when those power plant retirements happened, and to sort of reenact, but pretend that the dates were different when those retirements happened. And when we did that, we didn't see any effect at all, which was interesting. Like if we had seen that, then we would say, oh, well, this is probably explained by like some larger temporal trends in improvements in air quality and preterm birth. So that's how we tested it and felt reassured in answer to that extremely important question that you just posed. Because yeah, those kinds of things keep you up at night. Yeah.
Really interesting talk, thank you. At the beginning of your talk, you alluded to the fact that it's becoming more difficult to engage in this work in the current federal atmosphere, and I guess broader hesitation to talk about climate change. I guess I'm wondering if through this work you have any thoughts on whether the clarifier of climate gap is necessary when talking about these broader justice issues that I guess don't start with climate change, but do you think that perhaps there's a more strategic framing from a, I guess, advocacy standpoint to achieve the broader justice goals, I guess, that you're interested in?
Yeah. So when I write grants to NIH, I don't use those terms. There are a lot of terms that I used to use in my grants that I don't use anymore. When I write my papers and title them and do talks like this, I've made a decision. I'm not going to change kind of how I think about this type of thing. Plus, I've been around long enough so that people, they could just, Google me and kind of, I can't really change who I am and what I've been doing all those years, and I don't really want to do that. So I think I also think like there's a lot of great work to be done on climate change, and there still is funding to do work on the effects of climate change. Like everyone's obsessed with heat now, and there's actually a lot of federal resources to deal with heat. And so people should go for that money. They don't have to talk about climate change. There's a lot of other things that people can talk about. When we talk about just transitions to renewable and things like that, we don't have to frame it as climate change policy. Like things like switching the healthcare system can alleviate huge pain points for transitioning workers to different types of positions. It'd be one major thing that people would worry a lot less about. So I think, there's how you frame your work as a scientist when you're trying to get money from the federal government, and you know that they're running your grants through AI, and there's just certain terms you're not going to use. And then you hope for the best. I mean, my bar is I want to make sure my grants at least get discussed. So far, so good. I've gotten some good scores. Sometimes we get funding, sometimes we don't. I also go for a lot of non-federal sources to fund, for example, these community collaborations, which right now the federal government, which used to fund a lot of that work, like if you wanted to create the center of excellence of this, that, and the other thing related to climate or whatever environmental issue you're working on, you had to have funding for a community engagement corps and a community partner. That's no longer the case for a lot of RFAs. But that work we get funded through other sources, foundations, state money, unions. We've just been trying to parse out kind of the research translation piece, which is not supported anymore, and find other sources for that, and then focus the applications mostly on the science. And yeah, I agree with you. We don't talk about that's not in the title of our grants, climate gap. Yeah.
Obviously, from the organizations that you have posted here, you're very dedicated to producing useful and usable research. And Nikki's introduction talked about how you're widely respected in both academia as well as in the environmental justice movement. I think we have a lot of students who are interested also in trying to figure out how do they do this kind of work and how do they do it well. And so I'm wondering if you have any advice for either how you got started working with community organizations to make sure that your research was useful and usable. And just any advice along those lines.
Yeah. Well, so I guess the best analogy is like the 12-foot long Subway sandwich. You're not going to eat it all in one bite. You take one bite at a time to ingest it. So I think, when I was a graduate student, I wasn't doing these big projects. I was trying to just do my dissertation, but I was doing like small projects, often connecting with existing collaboratives that were already established, pitching in where I could, sometimes without having to create these things myself, because that's just, personally, I don't think that's very realistic. It takes a long time to develop those collaborations, to develop those trusting relationships, to be able to sit down, write the grant, and you have to, make progress and get done. Same thing when you're an early career stage, investigator. So I think it's important to really reach out to people that are established in doing this work, find out about opportunities, postdoc opportunities or project scientist opportunities. Start connecting with those established collaboratives. And then you start to build your own relationships with a lot of these organizations. And then the opportunities, what happened to me is, I joined something that was established. We established a relationship. The grant ends, but those relationships continue. We're still often mining that data, even though we may not have very much money or any money. And then a new opportunity comes out, and I can, we go for another grant. And by then, we know each other, so we can hit the ground running and start work. So one step at a time. Don't do it all by yourself. And work in collaboration and just be really clear about what your unique contribution is to that collaborative.
Can I ask the last question?
Of course. You have to have the last word.
Would you just talk about the role that REACT played and APEN played in your research? Very people to give an idea of what they actually did.
Yeah. We sat down and planned the grant together and decided on what the aims would be. And then they played a huge role all throughout the process when we were doing the analysis. They helped us ground truth the data, particularly when we first started in California, to make sure, help us, are we missing any facilities that are a big deal in these communities that the administrative data is not catching, for example. They had a lot of input in the development of the tool, so they did a lot of test runs of it and then gave us feedback on elements that worked and elements that were off-putting or not, very accessible. And then they led the dissemination of the project once we published the papers in terms of organizing. At that time, we were having Zoom events for different constituencies. So they organized Zoom events specifically for legislative staff and decision makers and regulatory agencies. They organized the agenda. They facilitated the whole thing. They decided who was speaking and for how long. We developed the materials with a lot of their input just to make sure it wasn't too wonky, but people got the point. And then they came up with a lot of the recommendations particularly for California, because there were just so many opportunities to influence decision making and get more resources for communities that were hosting some of these hazardous sites. So that was a role that these organizations played. We wouldn't have been able to pull off something like this without that kind of collaboration and knowledge, and then connection to the policy arena and to key regulatory decision makers that they had been, connected with and working with for years to make sure they were there to have an impact. So I feel like research translation really depends on these partnerships, because we're not very good at making numbers very compelling. So.
And I didn't say APEN and REACT are grassroots EJ organizations that were collaborating with Rachel and her team. So thank you very much.
Thank you.
One last round.